Hello and welcome to Season 2, Episode 11 of the Me and ADHD Podcast. And it's the final episode, actually, of 2024. But in this episode, we'll be talking about ADHD and the links to addiction. Now, I'll be the first person to admit that this topic is well above my level of knowledge, and I have little to no experience to this side of ADHD, apart from conversations with guests on my podcast and ADHDers on social media. But thankfully, my guest today does. Dr. Brian Licuanan is a licensed psychologist practicing out of California in the US. Works a great deal with clients struggling with substance abuse disorders and assisting families with strategies to get their resisting loved ones to accept help. So, from the other side of the pond, welcome, Dr. Brian.
Thank you so much. Good to be here. This is my first debut podcast in the UK, so I think this is great.
There
I've
we
done
go.
one in Australia. I've done one in Canada, but this is my personal debut for the UK. So I was glad that we were able to connect and coordinate this. So thank you so much for what you're doing as well in terms of spreading mental health education out there, and specifically for ADHD and its relationship to other possible areas of one's life, whether it be mental health. So really appreciate and glad to be here and speaking to your community there in the UK.
No, thank you. Thank you for taking the time, really, to appear on my little but lovable podcast. So getting started, let me just run through a few stats that I've come across. Now, Rehab's UK website says adults with ADHD have a higher prevalence of substance abuse disorder, 15.2% compared to those without ADHD, 5.6%. And it's got research shows that between 33 and 44% of young adults with ADHD experience alcohol misuse or dependence. And people with ADHD are 5 to 10 times more likely to have alcohol addiction than those without ADHD. And about 25% of these figures are horrific, to be fair. About 25% of adults receiving treatment for alcohol and substance abuse also have ADHD. And ADHD is associated with a higher risk of developing a gambling problem. Now, this one I found quite interesting. 70% of young adults with both a substance abuse disorder and ADHD report that they use substances as a form of self-medication rather than to get high. Now, I'm not sure how those figures track on the, in the US, but they're kind of shocking. I mean, I get the self-medication bit, to some degree, kind of thing. But why are so many ADHDers turning to substances and activities that can lead to addiction? What's your take?
Yeah. And if I may, one thing I like to do, they're great statistics as well. And I would probably, without having the knowledge of the statistics in front of me right now, would say that those are relatively precise in terms of the clinical work that I've done in my work in terms of people presenting with um, ADHD symptoms or having actual diagnosis of ADHD and its co-occurring conditions with mental health issues such as anxiety, depression, and also substance addiction. So, and for a lot of reasons for self-medicating. And um, I know your website or your podcast is focused on ADHD, so I'm assuming that your community is pretty aware of it. Do you want me to go over around ADHD, generally speaking, so they're aware of it, at least in my conceptualization and in my work with people? Is that something that you think would be important?
Yeah, you go for it. You go for it. Yeah, absolutely.
Okay. Yeah. So, because a lot of people, one of the things that I tend to do a lot in my podcast or media appearance when I talk to people is a lot of clarification of some concepts. I think one of the most important skills that we can have, whether it be in any conversation in the workplace, if you're a team leader or if you're with a group of people working on decisions, is defining terms, operation defining terms, because I could guarantee you that we could sit in a room with 10 people and they all have diagnosed with ADHD, and they'll probably provide 10 different definitions to some degree with similarities of ADHD, along with substance addiction, alcoholism, depression, anxiety. And my point being is we sometimes have this assumption that we're all on the same page. And I think it's very, very important to operation define terms. And one way of doing that is to clarify, at least in my perspective and my definition and conceptualization of it on that level. So um, and two, for your listeners as well, do you mind if I just give a brief, just what I do here in the United States in terms of my
Absolutely.
clinical work?
You go
So,
for it.
as you mentioned, yes, I'm a licensed psychologist of my PhD. And for almost 15 years, I did work at a treatment facility for clients with acute diagnoses or acuities of their mental health conditions, whether it be anxiety, depression, post traumatic stress disorder, bipolarity, schizoaffective, schizophrenia, ADHD, and so forth, with also severe levels of substance abuse issues. These were male and female adults. And so that's where I got a lot of work in that capacity. And also, I do have a specialization in insomnia. And I work a lot with substance use disorder and also with family crisis strategies and helping families come up with strategies to help a loved one who may be resisting any type of help or don't think they have a problem. And so that's just a little bit of what I do on that capacity, just for your listeners to get an idea of my perspective. But
Okay.
back to ADHD, a lot of one of that. So it stands for attention deficit hyperactivity disorder, and there's three general types, and some researchers talk about other subtypes, but there's the one where it is the predominantly impulsive type. And these are for people who present with hyperactivity, can't sitting still, mind racing a lot, and typically, but not exclusively, we see that type present in kids at a young age.
Yeah.
They can't sit still and so forth. They can't complete tasks. So that's one, predominantly hyperactive. And then we have a second type, which is predominantly inattentive, where typically speaking, people have difficulty sustaining attention, starting, completing tasks, multitasking, and so forth. And typically, with adults, if they did have the hyperactivity part, that tends to dissipate as they become adults, but not necessarily. And then the last one is a combined type, where someone presents with both the hyperactivity part and the inattentive part. And it is true. One thing that I tell people is people believe that, oh well, if I have an ADHD diagnosis, I can never be successful, and not at all. It's just like anything else. It's a condition, and on some many levels, it's a disability of some sorts. We have to understand that. It's also important to know that you can be very successful. You may know some very popular athletes or actors or prominent people who talk about their ADHD. Michael Phelps has been known to talk about, and his mom talk about how he had ADHD growing up, and that's why swimming was so conducive for him, is because he swam up and down the laps, structured activities to burn some of that energy, but also a very structured, well-defined activity as well that we could maybe talk about later. But yes, people can be very successful just because you have a diagnosis. You can't yet live a very productive life. It's just like with anything else. We have to sometimes curtail or make some accommodations, whether it be
Yeah.
treatment or behavioral interventions to help um, for you to be more fluid and to facilitate more productively in life. So that's one thing I want to say. And then sometimes we get people who also say, "Oh, it's a gift." Right? Oh, it's a gift. It's a gift. And some people, because what happens is, well, Michael Phelps has ADHD, therefore it must be a gift. Then I want to clarify that as well, is that people with ADHD have to take a lot of measures to navigate and be successful with the condition, but it's not a gift either. It's not like, oh, I have ADHD and so forth, but nothing to be ashamed about, but it's also not a gift. It's something that we have to manage and to treat and so forth. Okay. So, okay. Well, I just want to, hopefully that upfront information helped. And back to um, your statistics is, yes, in the work that I've done in almost 15 years, seeing hundreds of clients, if not thousands, not individually, but even on a group dynamic, is that there's a high percentage of people who present also have a co-occurring diagnosis of ADHD. The tough thing part about it, though, is if you have a substance abuse issue going at the same time, it's hard to pull out, is this person behaving hyperactive or inattentive because of another mental health condition or substance
Okay.
use, or is there an underlying condition? But generally speaking, the reason why that I have found a lot where people with ADHD are attracted to substances is because there's a lot going on here. And if they don't recognize how to manage it, whether it be racing thoughts, the reality is people with ADHD tend to have higher co-occurring mental health issues like anxiety and maybe depression, substance use disorder, having legal issues, having credit issues because difficulty paying bills, or speeding tickets, right? It's because there's this impact of dopamine, which is our chemical for pleasure, and 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 sometimes when ADHD, especially the hyperactivity part, the racing thoughts, they need something to kind of cope with that. Or if it's the inattentive part where they have difficulty, sometimes they believe a substance will help them settle down, help them focus.
Yeah.
And that's why a lot of people with ADHD tend to be attracted to stimulants such as caffeine, nicotine, and so forth, is because it actually has a calming effect when someone actually has an ADHD diagnosis, is because it can have a way to lessen the symptoms opposed to someone who doesn't. And someone that doesn't have ADHD drinks a whole bunch of caffeine, it will have a different effect than someone who has an actual diagnosis of ADHD. So,
Yeah, yeah. I find that quite weird. To be fair, it's an interesting one because I heard that. I've never been a big coffee drinker, and I can't go to the big places and have a cup of coffee with masses of caffeine in it. It's way too much. So
mhm,
I'm real sort of your basic Nescafe original kind of
mhm,
43 milligrams, whatever it is, of
mhm,
caffeine for a cup. It's quite on the low side. Um, and I've always known it doesn't make me sleep. That's why it doesn't keep me awake.
mhm.
It doesn't keep me
Yeah,
awake.
yeah.
I don't know if I feel like it actually calms down. Maybe it's not high enough caffeine wise, but it definitely doesn't. I'm drinking my coffee now. You know,
Mhm,
I know it's not going to keep me awake at night. So, but yeah, it's interesting how the brain is different when it comes to stimulants for ADHDers.
mhm. Yeah, and that's something. It's not, of course, that's not a predetermining or a confirmative data to say, oh, well, you have ADHD because you're calmed down. But it's one of the things that I like to ask when someone is looking for a potential diagnosis of ADHD. I ask, like, well, okay, do you drink a lot of coffee or monster drinks or those energy drinks? And they say, yeah, I can drink like two of them and it doesn't do anything to me. I still fall asleep. Or they find that, hey, it helps me pay attention more. But that's one of the questions I ask to supplement the other data,
Yeah,
um, in trying to look at it. But that's one of the ones where, like, when someone says, yeah, I drink like six shots of espresso in the morning and I'm fine at night falling asleep, or I don't get anxious or nervous as typically someone who doesn't have an ADHD diagnosis would.
yeah. So what happens then? So physiologically and psychologically, however you want to term it, what turns a participating into an activity by choice into doing it through necessity? So having again talking about addiction, be it on caffeine or nicotine or drugs, alcohol, from what changes from drinking lots on a Friday, Saturday, Sunday to then change it to a point where actually you start to drink because of necessity?
Mhm. Yeah. Well, one of the big things that I do talk about in a book that I wrote was that these it was geared towards people who struggle with mental health, especially with a substance addiction. And one of the must knows that I write about is the reason why people engage in a certain substance or even a behavior. Obviously, looking at one that is uh, unhealthy, is because it works. It works for what it was originally intended. But
Yeah,
we know that the longer we use, for example, a substance, the more we need of it, the more tolerant we become, and it becomes more counterproductive, dysfunctional. I call it the diminishing returns. Like, yeah, at first, a shot of vodka before my work meeting calmed me down, made me feel relaxed. But over time, it's no longer one shot of vodka, it's two and maybe something else, right? A shot of whiskey. And over time, physiologically, it becomes counterproductive and dysfunctional, both physiologically and behaviorally and so forth. And what happens is your body becomes accustomed to it, is because it starts relying on that behavior or substance to engage in some of those activities, whether it be dopamine, um, and so forth. And so what happens also when someone engages in a substance and they believe it works, they stop looking for other ways to also balance out and get healthy. For example, eating healthy, right? Let's say, for example, someone gets, like I said, the shot of vodka in the morning, and that's what works. Chances are not only will the substance decrease that motivation, it's just likely that people will start entertaining other things. Will go into the gym or doing something else to supplement, and then that becomes your, what I call, the life preserver, the one thing that keeps me going. And then when they get a physical addiction and an emotional addiction to it, and the thought of having to stop using that thing that they truly believe is the only thing that works is very scary for them. And that's where you get people who are resistant to getting help, who don't want to because they have to give up the one thing that they believe is the only thing that works. But we know there's other things that work um, as well and very healthy and are more productive and functional and healthy than obviously a mind altering substance such as those that we talk about.
As that's interesting. I didn't know that, or I didn't think of that way of thinking of like you're too scared to give it up because what I'm doing
Mm-hmm,
now, it works right now for me,
mm-hmm,
and if I give it up and try something else, I'm not going to get that help. I'm not going to get that support. I'm not going to get that calming effect that I so need, kind of thing. Um, that's yeah, that's an interesting fact to know. Because speaking to people, it's very hard to understand why people do things
mm-hmm,
that you don't do yourself. Like I said, I've never been in that sort of situation, or I don't know anyone in that sort of situation um, personally. But so to kind of like give that information, education is the key. To be
mm-hmm,
fair, and I'm very very much into everyone has a story. Everyone there's reasons for everyone's life. You know, but you don't get to understand it until you start to know the actual details of
mm-hmm.
the reasons and why they got to that place in their life in the first place. So yeah, no, it's just an interesting one.
Yeah, uh, and to a point that you kind of were alluding to, where sometimes people say like, well, gosh, if you it's a problem for you, why don't you just stop it? And people think it's purely willpower, right? And willpower is can be helpful, but people overestimate how important willpower, they believe willpower is the panacea to, for example, getting over a substance abuse addiction. That is one part of it. I'd say it's 15%. Things like fellowship, support, other activities that you engage in, that are like, for example, a healthy diet, the people you surround yourself with, and the type of environment you're in are really, really also critical factors to changing those behaviors. And so that's what happens a lot. And that's where you get some people who haven't been in the depths of a substance addiction or even ADHD can understand it. Like, well, gosh, you have a hard time sitting still. Just sit still, right? Or you have a hard time paying attention. Just tune everything out and just listen. And I don't know if you've ever heard that before, but
Yes.
that you get people who just, as you know, just don't understand, and that's why education and so forth is critically important. And even some people don't understand their own struggles or their own symptoms or their own diagnosis. And so, um, um, but yeah.
Yeah, it's like I said, I was diagnosed last year, so at the age of 51. So I spent sort of I guess sort of like 46, 47 years being told to concentrate, to focus more.
Hmm.
I'm like,
Yeah.
I've been trying my best to do that. No,
Hmm.
yeah, no, it doesn't. Yeah, you're right. It doesn't work like that. And ADHDs have they all have the same thing. They've all had it, especially late diagnosed. They've had
Hmm.
it all their life of like say,
Yeah.
sit still, concentrate, focus, try harder. I, there's no one trying harder than me to. My meds are run out for today. All right, there's I am trying really hard.
Well, you're doing great. Um, if I can give another of a metaphor, I'm not sure if you're familiar, if you come across his work, but Russ Barkley is a PhD, and he's pretty prominent in the research of ADHD. He
Yeah,
developed quite a few instruments, and his brother was navigating through ADHD
yeah,
himself,
that's right.
and kind of where his passion. So Russ Barkley. But one of the things he talked about in one of the talks that I've seen some time ago on YouTube was he used the analogy of a light bulbs in a room. Right. And so imagine like there's 100 light bulbs in a room that represent, all your different abilities and skills and so forth. And so he said, for example, if someone has a math deficit, like they just struggle with math, a math disability, or just understanding numbers and numerics. He said that's like unscrewing like two light bulbs in the room. Is because when it comes to math specifically, but it's not really affecting their friendships and so forth. It could affect their career, obviously, if they're in a job that requires math, but they're probably most likely not. But he said it's like that. But he said with ADHD, because people can have the general sense that ADHD is specifically for a classroom, right? Oh, well, gosh, it's a classroom issue or it's a work issue. But people don't realize, he said that when people are struggling with ADHD and not getting proper treatment, he said it's like unscrewing like 30, 40, maybe 50 or more bulbs in the room is because it's affecting other areas of their life. Relationships, just like what you were saying earlier, is that, hey, people have been telling me for 40 years of my life to pay attention. And so I'm assuming that could affect friendships, relationships, uh, people's view of you in terms of being responsible, maybe in the workplace. And so that's what happens is people just think ADHD is a classroom or a work-related issue, but no, it affects relationships. It affects a lot of areas of one's life. And like I said earlier, people with ADHD tend to, when it's untreated, tend to have a higher propensity for having legal issues, speeding tickets, substance abuse issues, a co-occurring mental health condition, which all can impact other areas of life, which is the workplace and relationships. So that's one thing. Another thing I like to clarify with people regarding the ADHD, and then one last thing too. You bring up a lot of thoughts in my head, and for anyone out there, right? ADHD is considered a diagnosis in childhood typically, but a lot of people go undiagnosed. Is that make sure you rule out a lot of other potential diagnoses is because sometimes there could be something else going on, but someone gets falsely diagnosed with ADHD. For example, there was a study some years ago of dentists um, who they had patients, kid adolescents or kid aged patients who were coming in for disordered breathing, meaning they had some type of breathing that maybe they had some nasal issue or some other thing in their mouth that was impeding their breathing. And he said quite a number of them that had disordered breathing were diagnosed with ADHD. And so the question is do these kids really have ADHD or was the disordered breathing manifesting or mimicking these symptoms? Because as a specialist in insomnia, right, when you have some type of sleep apnea, disordered breathing, you're not sleeping well. And so a child that's not sleeping well that has some type of sleep apnea, they're gonna be irritable. They're not gonna be able to complete tasks. They're gonna be restless in class. They're gonna be sleepy, and all of a sudden they may be rendered a diagnosis of ADHD and put them on Ritalin or whatever else. And so one thing that's gonna be very important is to really make sure that you're getting a comprehensive assessment. Make sure medical doctor that there's nothing else going on that level through blood tests or assessments. But even if in a psychiatric condition, anxiety in many ways could look like a lot like ADHD, racing thoughts, difficulty sitting still. And so I just want your community out there to make sure that they're seeking consultation and getting a really, really comprehensive diagnosis before concluding, not with just ADHD, but with any diagnosis, because a lot of the mental health diagnoses can look alike.
No, no, absolutely. And that's one of the things that I try to push across, and I try to have that conversation with people because it's not. People ask me, if I'm happy I've got the diagnosis and things like that, and I'm like, I'm happy that I've got answers. I
Hmm.
don't care about the diagnosis. I don't care what the title is or anything like that. It's the answers.
Hmm.
So now I understand my life. I understand why things have been like they are, why I am like I am, why I struggle with my focus, with my
Hmm.
with everything I go through. It's the answers. It's not the diagnosis. And I know there's people out there who want that diagnosis, and that's their core thing, their core thinking of they
Hmm.
have to have that diagnosis. No, you got to remember it's the answers, it's the correct answers. I
Hmm.
don't care if it's I've got vitamin B12 deficiency, and that's I have to take the
Exactly.
supplements and it all clears up. Fantastic,
Hmm.
brilliant. I don't care as long as I have the correct answers.
Hmm. Yeah, exactly. And you're doing the right thing. Is I always imagine a table, and let's say someone goes in and they have all these symptoms going on, and imagine on the table are different items, and all those items represent a symptom. And what you want to do eventually is take off on the table some of those items to zero in on some really strong possibilities. And that's what I was talking about earlier when you get people presenting to treatment centers. Let's say someone who had a meth addiction or cocaine addiction, and they can't sit still, they can't pay attention. So we're looking at a bunch of things. There's maybe ADHD, maybe there's anxiety, there's a meth addiction, maybe there's bipolar in there. But over time, for example, when they start to get sober and get healthy, maybe they start paying attention more, or maybe they're not manic anymore. So, okay, we could take off bipolar. And so, what we're doing is we're taking things off the table, but the way you do that is through assessment and taking out other factors that could explain some of those symptoms. And that's why in the substance addiction arena, you can have all kinds of diagnoses when you first present there.
Yeah.
You could be schizophrenic to bipolar to borderline personality to ADHD. When there's a substance or some type of issue going on, especially a mind altering substance. But over time, as the person gets healthy, then we'll start to get a bigger picture of what's going on. And I know this is out of the realm of ADHD, but if I may say,
Yeah.
we get a lot more substance induced psychosis, and psychosis meaning a detachment from reality, hallucinations, delusions. And you get people coming in there. And of course, if you don't know that they're on a substance, you say, oh, this person has schizophrenia. But no, over time, as they get sober, they don't have those psychotic features. And so, okay, they're
Yeah.
not schizophrenic. So this was a marijuana induced psychosis. This was a withdrawal from Xanax. And so that's what I mean by that. So a comprehensive assessment, and we got to take all those other things off the table, like the breathing. Like I said, that's not the first thing you would think. Like,
That's true.
well, and you'd look at comprehensively, well, hey, you snore a lot, and so let's make sure that that's not contributing or making it a false positive that you have ADHD or some other symptoms. So I would just want to bring that up as well.
No, that's fine. And again, it's good information. It's good for people to know, and it's all about educating people. At the end of the day, we're talking about this kind of thing at last,
Mhm.
out in the open. So you need to get the right information out there.
Yeah.
So when it comes to addiction, then is addiction, be it from say drugs or alcohol, is it different for an ADHD to a than it is to a neurotypical person technically, or is it exactly the same when it comes to like your
Well,
brain?
I mean, just just off the cuff, they're different because if someone has a diagnosis of ADHD and someone doesn't, they're different on that level to begin with. But is there anything scream out as to are they much different? At the end of the day, a substance specifically is to cope. is to cope with some type of discomfort or some imbalance. That's what it does, is because our natural tendency as human beings or in living organisms is to bring balance or homeostasis. And there's healthy ways to bring that and unhealthy ways. And so at the end of it all, and that's what I talk about with people in treatment, is because yes, they're different. Maybe someone has ADHD and someone doesn't. Maybe someone had used substances and someone didn't, or maybe someone had trauma in their life and someone didn't. I said the reality is you're all different on paper,
Yeah.
but the common threads that you all share are very, very thematic. And a lot of times, whether you have ADHD or something else, a substance is used to lessen, mitigate some type of symptoms that they want to get rid of, right? Whether it be a past trauma, racing thoughts, whether it be whether it be guilt, whether it be um, anything, bad memories. And so that's the unifying theme across people. But in terms of their individual differences, yeah, I would say so. Like I said, what we talked about earlier, neurologically, people with the hyperactivity part can't sit still and can't pay attention, and they find something that kind of they believe helps them with that, or deal with their anxiety, or deal with other avenues of their life. And so, yes, there are some of those differences, but the use of substances, I would say, is to cope or bring some type of balance for some type of imbalance.
Yeah. Yeah. No, that makes sense. And also, still on that lines of taking a substance. A lot of There's a lot of talk. There always, I guess, has been for a long time. And I hear it a lot all the time as well, about ADHD medication. It's stimulant medication, and you take that, and that could lead to addiction and things like that. So
Hmm.
you shouldn't take it, and it's bad for you and everything.
Hmm.
You got a lot of skeptics out there, and which is
Hmm.
fair enough. It's not for
Hmm.
everybody, but everything I've read so far, and you may correct me with this, if it says that if you take it as prescribed, and your ADHD, you
Hmm.
take it as prescribed,
Yeah.
um, studies have shown that it doesn't increase the risk of addiction. Is
Yes,
is that
definitely, definitely. Taking it as prescribed. I mean, there's risk factors. There's always risk factors for anything, but number one, is if someone has a family history of addiction, or they themselves struggle with addiction or addictive behaviors. I mean, that's not um, a foregone conclusion that yes, you'll become addicted, but it's a risk factor
yeah,
to it. Um, 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 and any other co-occurring conditions or mental health conditions. But yes, if you take the medications as prescribed, and yeah, you can have very, very favorable outcomes for the person, especially if they're supplementing it with other interventions, such as maybe therapy to help with ADHD behavior skills or life coaching skills. So it's not the panacea. It's not I take this pill, then everything's gonna be fine. The hope is you're doing other things in life that are um, helping you in your own path to better health. But for people out there that may not know, there are non-stimulant forms of ADHD medication as well, um, um, that are non-methylphenidate. And then, of course, the stimulant ones. And then you work with your doctor. There's a lot of people with kids, of course, taking holidays because it may impact growth. And so, but as long as you're working with a professional and being mindful and manage it, but does it have the addiction potential? Yes, and especially for people, the reason why ADHD medication is a controlled medication is because um, for people that don't have ADHD, it's speed. Basically, it's the form of speed where it has benefits, and unfortunately, people sell ADHD medication,
yeah,
and you could sell it for. There's issues here on the university, even the professional levels, where people who don't have ADHD are abusing ADHD medication because it keeps you up, It's a form of weight loss because it suppresses hunger. On the college level, the graduate school level, you take one and you don't have ADHD, you can memorize things very well, but it's short-term memory, and you get people with ADHD medication induced psychosis who are abusing it as well. So that's why it's really tricky as well with that. But yes, overall, someone takes it as prescribed, and they're supplementing it with therapy or other skills, behavioral skills. You can have very, very favorable outcomes.
It's, I guess it's a bit of a joke within the community that when it comes to this topic and the ADHD meds, that we struggle to remember to take the meds in the first place. It's just not, so we got no
And
chance.
don't double up. Don't double
This
up.
is
If you
yeah.
forget your dose, 2 doses yesterday, don't take four the next day.
No, absolutely, absolutely. So when it comes to again to addiction, how long does it take for someone to become dependent? Is there a kind of a general rule of thumb how long it will take, or is it just it depends on what substance, depending on what activity, depending on the person?
Yeah, it is hard, is because there's so many factors involved as that um, that when people don't recognize that it's a problem. And sometimes that is self-awareness, but a lot of times it's not. It's situations that they're in where they are alerted that, oh, wow, this is a problem. For example, work performance decreases, relationships, person is becoming a certain way, change in behavior, they're more irritable, they're not present, there's just a change in their lifestyle, they're less motivated to do things they normally do, or they're engaging in more. So the work that I do, uh, it's more often than not, it's not someone wakes up and wow, I'm drinking way too much alcohol. It's a problem. Yes, are there cases like that? Yes, but I would say most of the time is, hey, uh, you lost 3 jobs in 6 months, and you're drinking a lot more, or you've just changed over this past year, and I've noticed that you've been engaging a lot more marijuana smoking, and so usually that's where they become alerted, and maybe they do know that something's wrong if they just need to hear that information from someone else. So it really, really varies on the person, because there could be people that could be casually drinking on the weekends and with on the work level or with social, and they don't really realize the problem. And next thing you know, they're not drinking on the weekends. Maybe they're drinking one day in the week just to wind
Yeah,
down.
yeah,
And so it's really really hard, and I would say that it depends on a lot of some of those factors what the substance is. There are substances that are way more rapidly addicted than others, like heroin, of course. With one use, you could become extremely addicted and dependent on it. And but it is really really hard to say definitively. But if for your listeners out there, um, if you have a loved one that all of a sudden just drastically changes in their hygiene, behaviors, they're more irritable, it's just something very different. I'm not saying to conclude that they're an addict, but we want to pay attention that something's going on, especially if they're engaging in substances that that could definitely be a variable in why they're changing and not for the better.
so that's got to be a big factor then. Your environment you're in, the support
Mm,
structure that you have, be
mm,
it family, friends, relationships, and all that.
yes. Oh yeah. So if you're with a group of people that we drink and party and blacking out is culturally okay in our foot, yeah, it's going to be very hard to distinguish when there's a problem. And so your environment that could perpetuate the issue as well. And so, but for your listeners out there, if you are engaging a substance and maybe you have that self-realization that, wow, you know what, I have drinking or using a lot more substance or drinking a lot more and I'm just not happy, I'm not feeling right. Hey, raise your hand, be humble and ask for help. Seek help anonymously, or meaning that you don't have to tell your family, but get some help. Trust your instincts. And especially if you feel like something is changing. There's a saying that I'll say it twice. The degree of one's coping mechanism is directly proportional to one's degree of pain. The degree of one's coping mechanism is directly proportional to one's degree of pain. So your coping skill obviously could be anything. It could be a good thing, prayer, meditation, mindfulness techniques, working out. And of course, that's the more maybe healthy ones considered. And there's unhealthy ones, which are substances, avoidance, blame, anger, or what have you. Um, and when you're using that coping mechanism to a high degree, most likely you're trying to compensate for some degree of discomfort or pain. And so if you've noticed that your consumption of alcohol has significantly increased over the past 3 weeks, ask yourself, what's going on in my life? Well, geez, yes, I'm having a divorce happening, or I'm disconnected with my child, or work's been very stressful, or I'm fearful that I'm going to lose my job after this merger. Um, so but people, be self-aware, trust your instincts, and ask for help if you feel like something is not going well.
So what? I guess I know. See, over in the States, things are slightly different over here. But in the UK, if you want to seek help, I mean, you would normally go to your GP first of all, which is your general practitioner, primary care physician, I guess over there, family doctor. Um, and say that you're struggling with whatever substance. Then you'll get referred to the NHS for treatment, or you can call a multitude of sort of helplines. I mean, over
Hmm.
here we've got the Frank Drug and Alcohol Support Helpline.
Okay.
You've got Mind, who have a huge list of support organisations on their website, and Rehabs UK, who can put you into contact with private clinics across the UK.
Hmm.
Um, so, what would the process be in the US to find help? So, someone thinks, okay, I'm struggling here. I think it's with whatever drugs or it's alcohol or something.
Hmm.
Who do they see first of all? What is generally, what happens?
Well, it can all those things are very similar, by the way. And one thing, do you have NAMI at the UK, National Alliance of Mental Illness? Have you heard of that?
I haven't heard of that. No, not to say that we don't have it, but I've just not heard of it.
I believe they're international. They are international as well. I just don't know if how pervasive they are in the UK. But just as another resource, National Alliance of Mental Illness. It's a huge organization that provides services to families or people struggling with mental health or addiction. So if any of your listeners as well are looking for something as well, they're a resource. But even though if they're not in the UK, it doesn't mean you can't get on their website and look for some of their services as well. But yeah, I think back to your question, I think it would go the same way. There's no one direct path. Some people, it'll be through a doctor and then they get referred. Some people, they'll call one of these support organizations and go. Sometimes we have AA meetings, Alcoholics Anonymous meetings, Narcotics Anonymous meetings that you can just go. You don't have to sign up or register. Or some people go directly to a treatment facility where, hey, I'm really struggling, and get through assess there to see if appropriate fit. Some people go in the hospital if they're really, really struggling. So it sounds like very similar to the UK. There's just no one direct path to getting the help on that level. But the important part is for you to tell on yourself and say, I need help. That's the first step. And all that stuff will come into play. And there's just, especially now with the internet, there's just so many ways to access help. There's really no excuse
Yeah,
not to find sources to help. Now, things like affordability and insurance, that's a different um, conversation. But in terms of um, help and support. There's a lot of free services out there, like the ones you mentioned, NAMI. There's the AA community, and then there's smart recovery if people aren't into so much the God component or the 12-step aspect of it. So there's so many support groups online, in person. So there's really no reason for someone to say, well, there's no help out there.
yeah, yeah. Yeah, no, there is, and that's true. I mean, again, with the day and age of the internet and social media and things like that, you're gonna find it's very easy to find where the help is. making it you got to make sure it's the right fit for you, um, and it's in your local area as well, so to speak. But it's yeah, there's definitely information out there,
Mhm.
which is good, and
Yeah.
information that I'll put some stuff on the podcast, links to um, various different associations that people can get in contact with over
Mhm.
here,
Yeah.
in the States as well, um, and also obviously, with your details as well, obviously, because you're my
Yeah.
guest. So
Yeah.
it would be a bit weird if I didn't. So just another quick question before we finish up. So is there a way of kind of like sort of looking at what you're doing or looking at potential issues in your life, when it comes to addiction, be it like the drinking, um, be it cocaine use or whatever it is, to look at it and take steps to start avoiding things and start to turn the corner, the right corner.
Got it.
Yeah,
Got it.
is there something? Is there a kind of a mindset you have to be in? Is there a kind of a process you have to? I'm sure it's not as easy as this. I just won't do that. Is
Exactly. Well, I mean, again, there are different factors. I think just being honest with yourself and self-awareness is critically important. What happens a lot is if we don't have a great understanding of who we are and what we want, we become very vulnerable, right? Is that okay? This is kind of what I want. Well, this is cool. These people engage in these behaviors, so this must be the way I fit in. And so I think having a self confidence of who I am and what I want in life is a first step, is because you're less vulnerable
yeah,
to find yourself in vulnerable situations. If you know what you want, if you know that, you know what, I want to be as healthy as I can be, I want to be a spiritual person, I want to be the best father or parent that I can be, what you're going to do is you'll most likely pursue the things that will maximize that and avoid the things that won't. One of the great things too that I heard one time on an interview was he had an actual rule or law for it, but for example, if you want a happy marriage, instead of searching for all the attributes of having a great marriage, he said, what would be all the attributes that will lead to a horrible marriage first? And then work from that. For example, aspects of a horrible marriage would be, very limited communication, or focus only on my own needs, or criticizing my partner, or all those things, and work the opposite. So someone that doesn't want to go that path is, for example, if I want to be the best parent I can be, think of all the things that would make me a bad parent. Not being present, overworking, not having intimate conversations with my child, um, going out too often or drinking excessively. And that might be more enlightening and crystallizing of keeping you on that path. But like I said, that whole aspect, a lot of people who find themselves in tough situations with addiction, um, is a lot of times they're hitting a moment of being lost
yeah,
in where they're heading or what they want. So I think that would be the first step, is being honest with that, and then surround yourself with people who facilitate that, right? And and so um, um and that'd be my first step, um to helping people
okay.
um
That
steer in the
makes
right
sense.
direction.
That makes sense. It makes perfect sense. Like I say, surround yourself with the right people. I, my circle of friends and family is small. Um, I keep it that way now because I don't want the baggage. I don't want the stress. I can't take it. I look back in my life, and I've just been constantly overwhelmed, by
Hmm.
so many things and not coping because of
Yeah.
so many things. So all those things that stop me from coping, I've gotten rid of,
Yeah.
as much as possible. So it makes a huge, huge difference.
Yeah. But to surround yourself with the right people, to know who those people are,
Yeah,
you have to, as much as possible, know who you are and what you want. Because if you don't, you may think that these people are the right people because they make me feel better, or they accept me into their culture, or they don't judge me, but yet those are great qualities. But what they surround themselves and what they behaviors they engage in are maybe not the healthiest. And so to know who to surround yourself with, the right people, you have to know, like I said, you have to be very clear as best as possible to know yourself before you can determine who those right people are.
Agreed. Absolutely. This has been, it's been really really incredible, eye opening and heartbreaking, to be fair, but still an incredible conversation.
Thank you.
And it's hard hitting for a lot of people, and I know especially for
Hmm.
the ADHD community as well, who I speak to. But it doesn't just affect the ADHD community, obviously,
Hmm.
and it's a bigger problem, if that's the right word or not, than I thought it was. You know, it's
Hmm.
when I started looking at the help, the associations out there, to help with addiction, how many there is, kind of
Hmm.
highlights how bigger an
Hmm.
issue this is. You know, it's
Hmm.
not just, you know, one or two sort of clinics in the UK or the US or whatever it
Hmm.
is.
Yeah.
This is a huge thing that's going on, and that needs to be tackled.
Hmm. Yeah.
And like I say, one way we can start tackling it is being honest with ourselves, you know,
Hmm.
and surrounding ourselves with the right people as well, and asking for
Hmm.
help, and which is hard for a
Hmm.
lot of people, but that's what we got to do. And
Hmm.
you know, us talking about things all the time and being open and being really honest. That a lot of people that have on the podcast
Hmm.
really lay it down, really, you know, open up completely about their stories and what they've gone through, what they've done through, what they've done, and how they really feel. And if which is great, that's what we need, because we
Hmm.
need to be okay with talking about it all.
Exactly. And
Yeah.
and one thing that when you talk about it, you destigmatize it. You take away that negative label. Unfortunately, that happens sometimes is and that can happen in the classroom setting where someone is labeled with ADHD and therefore, but we have to destigmatize it. And like I said, that's why upfront it is that just because you have this diagnosis doesn't mean you can't be successful, productive, be a great parent, a father, a spouse. Yeah, it's just like anything else. If someone's diagnosed with diabetes, doesn't mean you can't have a productive life, but do you have to make some adjustments? Absolutely, right?
Yes. Yeah.
And so we all have our thing or things that we have to be mindful of, and ADHD is just one of them. And so, talk about it, and the way what you're doing really helps clear up the stigma that's out there for not just ADHD, for any mental health condition.
No, absolutely. I was diagnosed with um, depression, anxiety, which a lot of late diagnosed ADHDers were um, sort of told they had, and that was the core problem. Which
Hmm.
we now know it wasn't the core problem. It was there because of the
Hmm.
ADHD and everything else that went with it. But before that, you know, when that was just my problem, I couldn't talk
Hmm.
about it. No one knew about it. I spoke to
Hmm.
my wife, but I didn't speak to the rest of my family. No, no, there were no words. I couldn't explain it. There were no answers, you know, because you're going to say I've got depression or I have anxiety. Someone's going to say why, and it'd be, I don't know. I don't have the answers. Haven't got a clue. It doesn't make sense. But when you get help, you get support, and you find out what's really going on, and you get the answers. When I got my diagnosis and everything, I, I I can talk. I've never been a talker. I've been very quiet. I've been social anxiety. You know, I've kept
Hmm.
myself away. And as soon as I start finding the answers, here I am now talking on social media, doing
Yeah.
podcasts, talking about what I've been going through and being very candid with what I've
Yeah.
gone through, which I couldn't do before.
And that's part of your healing process
Yeah,
as well.
absolutely, absolutely.
Yeah. So not only you helping. Yeah.
This little laptop here is my therapist. You know,
Yeah.
so
Yeah.
it really does help. So
Yeah. And not only helping others, you're also healing yourself as well. So Yeah, great conversation. We hit a lot of good topics out there. Um, yeah, so I really, really enjoyed, and hopefully your community there in the UK benefits from some of the stuff we talked about today.
No, absolutely. I'm sure they will. I'm sure they will. They're going to love it. I've loved it. This has been really, really good, and it's nice to have someone in a certain standing with with your background. Usually, it's people, just normal people talking about their life experiences and my life experiences,
Hmm.
things like that. So it's nice to have someone like yourself coming on and giving your professional opinion on things. Um,
Yeah,
but it's been great. I mean, thank you for everyone for
thank you.
listening, but thank you for Dr. Brian for
Yeah,
coming on and sharing your knowledge and your time with us. Um, and I will be back in the new year with some more ADHD related conversations with some lovely people. But as always, guys, be good, be kind, and remember, you're not alone. Thank you.